than to others. But if we give you the statistics of the levels of fraud and forgery that are going on with regards to the procurement and availability of certificates, either travel certificates or even vaccination certificates, you'll be amazed. And I want to urge you, as the members of the fourth REM, to try as much as possible in your write-ups, discourage that. Because the peril and the danger to which we are all put to is unquantifiable. Because the first step in addressing any emergency is first to ascertain what is the problem. And if the source of your resources in terms of information is faulty, then the necessary prescriptions will not be there. The vaccine mandate will come into effect fully on 1st of December 2021. And I encourage every federal government worker, and in essence, all Nigerians and residents to get vaccinated. We have an abundance supply of vaccines now. The ED of the Primary Healthcare Development Agency will give you the details and the quantities of what we have in stock and what we are likely to get even before the end of this month. The number is staggering, but we need the hands or the arms to receive these vaccines. With the developments around the world, people will not be able to travel without their verified vaccination cards. You can see from what is happening. One mutated variant now has caused a total confusion within the global space. Every country trying to find and navigate its way out. But there's so much we can achieve if we work collectively and in unison in fighting this virus. The Presidential Steering Committee will want to inform you that the impasse on the Nigeria-UAE flights have been resolved in the interest of both parties. Although this process has taken so long to pull through with its ripple effects, we thank everyone that was involved in getting this deal. A date for the commencement of flights between the two countries will be announced in due course because of the protracted delay or the protracted non-resolution of the matters. When you resolve, you need time to plan for the airline and other airlines that are operating in and out of Nigeria into Dubai to make all the necessary arrangements in terms of sequencing the aircrafts that will be used on the routes before commencement of the flight. The National Primary Healthcare Development Agency is ramping up vaccination around the country to ensure that citizens have access to the vaccines wherever they may be. The vaccines are now available, so we need people to go get their jabs. It is increasingly becoming expedient for everybody to be vaccinated because very soon you can't even travel out of this country. No airline, very, very soon, by what is being in place all over the world, would allow you board any aircraft to any destination without being vaccinated. Even countries that have sufficiently vaccinated their people to about 80%, countries like Israel and the rest, because of these mutated variants, have shut down again. Lockdowns all over. So we have to be proactive in getting our populations vaccinated. Because of the high mobility of Nigerians, we like traveling. We travel the globe. We do not want to have anything interrupt our desires to go, to visit loved ones, to travel the world either on vacation or on official assignments. The vaccines are now available, like I said, so we need people to go and get their jobs. The executive director would elaborate on this. I announced at our last briefing that the PSC's 9-month mandate extension will come to an end by 31st December 2021. In order to effectively capture the core elements of our national response, a national summit to end COVID-19 in 2022 and to strengthen global health security is being planned to hold in Abuja here from the 6th to the 7th of December 2021. The Presidential Steering Committee looks forward to welcoming all stakeholders to this all-time summit. I now have the pleasure to call on the Honorable Minister of Health, followed by the DG, NCDC, ED, National Primary Healthcare Development Agency, and the head of the Technical Secretariat to provide you with technical updates. I thank you for listening and have a wonderful evening.
The Secretary to the Government of the Federation and Chairman of the Presidential Steering Committee on COVID-19, Honorable Minister, Permanent Secretaries, DGs, Executive Directors, and Directors who are present, ladies and gentlemen. We have observed a steady decline in figures and fatalities over the last few days and weeks regarding COVID-19. The decline is generally regarded as a sign of victory, as a sign of success. But we have always made it clear that we are not yet out of the woods. We are still required to be careful about our movements and about our compliance with advisories. The Director General of NCDC will give all the figures, but the focus suddenly came some time ago on a new variant that appeared, said to have appeared in Botswana or South Africa. Again, the origin is still now being disputed, but more of it will come out soon, which has created some anxiety all over the world and also created anxiety in Nigeria. We have taken measures to ensure that Nigeria is in control of the situation, but the way all the various variants have spread around the country, it is almost going to follow the same pattern of going around the world to all countries. It's just a matter of time. Therefore, the government role, our role, Ministry of Health, PSC, is to put in all measures which we are doing now, surveillance at our points of entry, increased surveillance, and testing, and trying to encourage all the participants to come on their toes. As at the moment, we have plenty of room in our isolation centers. Only 5 persons are on oxygen, and we have no distress at all with the beds. But we are on alert and going to be ready. But citizens also have a role in that there are 2 very, very strong measures that can help us. One is the vaccination, which has been mentioned here. 2 shots as prescribed by the experts and being administered by the National Primary Care Development Agency. And the second are the non-pharmaceutical interventions or public health measures, which we have been preaching for a very long time and which we will not get tired of preaching. because those are the simple measures and the cheaper measures with which you can preserve your own life, protect yourself and your family. The mask, the social distancing, and of course, hand washing, sanitizing, and avoiding gatherings. Now, that part of it is difficult, and I will say, especially as the festive days are coming, bear that in mind, particularly for those who have comorbidities, obesity, hypertension, diabetes, tuberculosis, any other kind of disease that is chronic makes a person vulnerable to very serious illness when infected with COVID-19. It is your duty to protect yourself and also protect your loved ones. So if you have a loved one, an elderly person, or anyone who has any of these comorbidities, it is your duty to protect them. That is part of the role of the citizen that the citizen has to play. Now, the new virus that came out was originally named the B11529, and using the tradition of naming them after Greek letters of the Greek alphabet, this one was named Omicron. The Omicron is believed to transmit very, very rapidly and very easily, but up till now, thankfully, not many fatalities have been. In fact, I haven't heard of any fatality or any severe illness arising from it. But nevertheless, it has been seen in many countries in Europe, in Hong Kong, and even in Canada. And eventually in Nigeria, the sequencing has already started of all cases that are coming up. And we even received reports, if you are looking very closely, of a citizen of our country who was tested positive in Canada. As I said, we are scaling up genomic sequencing. But then again, the actions that have been taken so far by other countries wake us up to the fact that we must also struggle for ourselves. Today we had the World Health Assembly, a special session to address the question of response to pandemics, any disease agent that threatens many countries, that threatens many people at the same time across borders, should not just be a disease in which every country will respond in its own self. That there should be a global standard, a global collaboration, because the threat is not just to one country, it's to mankind. And that was the focus of the World Health Assembly today, which Nigeria supported, that once it's defined as that, there should be something like a global public health treaty that should be governed and run or minded by the, operated by the World Health Organization, so that all countries have a uniform standard, all countries are able to support each other. With regard to things like vaccine, for example, when a lockdown becomes necessary, some countries are cut off. They're cut off from PPEs, they're cut off from therapeutics, and they're cut off from vaccines. That is the reason why regional production is also being advocated for, regional production of public personal protective equipment, diagnostics, reagents, and also vaccines. Nigeria is still pushing for vaccine production and working in that direction with prospective technical partners for looking for technology transfer. So as far as the preparation for the COVID-19 Omicron variant is concerned, we are adopting a watchful waiting posture. Watchful waiting posture in that we are looking very closely at all developments and watching the points of entry, particularly with a lot of alert. This virus again proves that a little variation in the structure, the mutation, brings out a totally different nature, different character, of which it might be very virulent, or it may not be, or it may just be like before. But the readiness that we have to maintain will be largely from population, Non-pharmaceutical interventions, getting vaccinated. We are not short of vaccines. The chairman just emphasized that just now. We have a lot of vaccines. We are urging citizens to come out, and we are very far behind when it comes to global vaccine metrics. We are way behind other countries who are, in fact, also very worried about the new variant. And the realization that that may probably not be the last. Therefore, vaccine production capacity and capacity to produce what we shall require to protect ourselves, protect our citizens, is one of the strongest measures that government will be taking and looking for. Thank you for your attention.
The Chairman, PSC, Secretary General of the Federation, Honorable Minister of Health, Honorable Minister of State for Health, Directors, Chief Executives, colleagues, gentlemen of the press. Well, as you're all aware, I'll just dive straight into the issues, but as you're all aware, the Omicron SARS-CoV-2 variant has been classified as a variant of concern and has now been detected in many countries globally. While the Delta variant is still the dominant SARS-CoV-2 variant globally, this new variant that was first detected in Botswana and South Africa, which then we are the first to report it, has also been detected in many other countries now, and that number is increasing. So Australia, Belgium, Canada, Germany, Israel, Italy, and the UK. And as has been highlighted earlier, unfortunately, the excellent work done by our colleagues in South Africa through their expertise in genomic surveillance has been rewarded by travel bans. But enough has been said about that already. I think the important thing to also note is that the index cases identified in Botswana were actually travelers from West Africa. So this gives you an idea of how pathogens spread. By the time you identified them and think about locking borders or so, the horse has actually already bolted from the stables, and your actions are a bit late. So I'd like us to focus on what is really important. Why are we concerned about this virus? Well, we are concerned because it has mutations. Mutations are changes to the genetic makeup, which currently have a theoretical risk of increasing the transmissibility of the virus, a theoretical risk of escaping protective immune responses, including those that are induced by vaccination. However, this is a rapidly evolving field. There's a lot that we do not know yet, and there's a lot that is currently under study. So I do not encourage citizens to speculate, to waste energies on speculating. I think what we need to do is to focus on what we actually know. And what we know for now is, given the genomic surveillance so far, is we do not have a case confirmed in Nigeria at the moment. Now, we have a pipeline of samples that are in process whose results will be ready tomorrow. So this situation, of course, can change tomorrow. So I am speaking as things stand now. What we also know is that, as you have already seen in the news, there are two cases reported in Canada with history of travel to Nigeria. We are waiting full information from the Canadian authorities to know who these travelers are, but more importantly, to understand the nature of travel. Were they following a multi-country itinerary that involved transient stops in places including Nigeria, or did they spend significant lengths of time in Nigeria? If they spent significant lengths of time in Nigeria, we would like to track down their COVID test results to see if they were negative as at the time they left, or to try and gain some understanding about when exactly they tested positive. We also know that there is a traveler who we've been alerted to about the UK authorities, who traveled to Nigeria from South Africa by way of the UK. Thankfully, we've been able to confirm that the pre-return PCR tests is negative, and then the repeat day 2 test is also negative, and this passenger is fully vaccinated. But authorities are keeping tabs to see if there's any more information that may be relevant for the purpose of intervention. So I'd like to highlight why we have a mutant virus. Obviously, we went through the situation with Alpha, with Beta, with Delta, with Gamma, and then we had the waves that accompanied them. I think what citizens need to remember is that variants arise from situations of unmitigated transmission. As I said in my press briefing the last time I was here, it doesn't matter whether you can see it or not, whether you believe that it exists or not. The point is, this virus is being transmitted, and every opportunity it gets to transmit or to move from one place to the other confers on it the advantage of changing. With the advent of a new variant, it is important to mitigate transmission. Otherwise, this variant has even more opportunities to transform as it reproduces and is transmitted from one person to the other. And maybe we might just have such constellation of bad luck, for want of a better description, that the virus changes in a way that it truly becomes dangerous. And we do not want to see cases and deaths of the order of magnitude that we have predicted before people believe that there is something going on and they should take precautions. Again, I must reiterate that vaccines offer an option to mitigate transmission. Please make use of every opportunity that has been afforded to you to get the vaccines that are freely provided. They are freely provided and offer our best opportunity to return to normalcy. We're talking about the normalcy of not having travel bans, of allowing investors to be able to visit, and all the other people who need to transact business with us, to allow free movement of goods and persons. Before I close, I'd like to briefly touch upon what the NCDC is doing to assure our health security. Obviously, we're working very hard to enhance ongoing surveillance, especially for inbound travelers, but also trying to ramp up testing within states for our population level efforts. As you would hear later, there will be changes to the travel policy, and we will be working hard to enforce some of those. The aspects of the existing policy, which include day 2 tests of renewed efforts to enforce them. We will be tracking people through the portal and the labs that they've registered with to ensure that they do their tests. We will consider publishing names and passport numbers of people who do not comply with their tests. And the PSC is prepared to go all the way to actually suspend passports, as the case may be, all in a bid to ensure that these rather simple measures are adhered to protect the rest of the population. We will ramp up testing at the land borders and make that quick by using rapid diagnostic tests, while, of course, retaining samples for PCR testing for the positives. We are conducting genomic surveillance as before, and currently have all the samples that have accrued in November in the pipeline and ready for results by tomorrow. And we will continue over this period when we anticipate more travel to rapidly sequence all results that meet our selection criteria and enhance that process by using diagnostic kits that provide pre-identification of the likely samples that may benefit from sequencing. As I said, interrupting transmission, preventing transmission is our best bet to return to normalcy. And those we can only achieve by vaccination, by adherence to the simple measures that work, such as wearing your face mask, washing hands, maintaining physical distance like we do, avoiding unnecessary travel. And over the next coming days and weeks, the NCDC will be ramping up messages and interventions targeted towards the Yuletide and travel that we expect, all in a bid to ensure that we avoid this fourth wave that is appearing imminent. I do not take for granted that there is substantial pandemic fatigue. People are tired. Even as the NCDC director, there are times I wonder, should my mask be on or out? And I find that I've got to do risk assessments for each place that I am in. So are you at risk if you take off your mask for a few seconds, or if you take off your mask for 15 minutes? Are you at risk if you're outside? So we're all human. We recognize the challenges that we've had for the last 12 months plus, but staying healthy and preventing your loved ones and yourself from getting COVID is a sufficient reward for all of that inconvenience. As we said earlier in previous press conference, and I'd like to reiterate now, our data shows that even for the people who catch COVID, most of the severe manifestations and the deaths are among the unvaccinated. So we're not just talking about vaccination as a means to inconvenience people or to, I don't know what the conspiracy theories say, to make money for pharma and all. Vaccinations offer protection. They offer protection to us. They prevent transmission. They prevent the deaths of our loved ones. So this is not the time to be tired. This is the time to be vigilant and to ensure that we do not have this variant or indeed any other variant that may be cooking to compromise our health, our economy, and our country. Thank you all very much for your time.
The chairman of the Presidential Steering Committee, honorable ministers, colleagues, distinguished ladies and gentlemen of the press, good evening. As of today, the 29th day of November 2021, 6,504,043 eligible persons have received the first dose of the COVID-19 vaccine in Nigeria. None of these persons have died as a result of taking COVID-19 vaccine, while 3,586,812 persons have been fully vaccinated against COVID-19 with both doses. So far, we have over 30 million doses of the vaccine at hand, and we have gotten commitment of over 60 million that will arrive by between now and the first quarter of 2022. I would like to remind all federal government employees that starting from December 1, they will be required to show evidence of being vaccinated against COVID-19 or a negative PCR result done within 72 hours before being allowed into their offices. To further ease access to COVID-19 vaccines by these government employees, we have also commenced office-to-office vaccination in some ministries, departments, and agencies. What this simply means is that employees who are yet to be vaccinated will find a vaccination site around their offices to register and get vaccinated. This will help in preventing the excuse of having to leave their places of employment to a distant vaccination site. We're trying to finalize and make sure that all offices are covered. We would like to also state that from time to time, civil servants will be picked at random to check or access their COVID-19 antibody titer to detect persons who have fraudulently acquired the vaccination card without taking the vaccination. Anyone who has been found to have fraudulently obtained this card will be handed over to law enforcement authorities. Again, the vaccines are free, and we're making them available to a site near you. We have also engaged and are collaborating with the Nigerian military, the police, and paramilitary institutions in the establishment of mass vaccination sites in their locations around the country. We will also be assisting with the deployment of our vaccination teams to all sites identified by these institutions. In collaboration with NPHCDA, the National Commission for Refugees, Migrants, and Internally Displaced Persons, NCF-RMI, is planning to launch the mass vaccination in refugee and internally displaced persons camps across the country. This is to ensure that all refugees and internally displaced persons and their families are fully protected and that the camps are safe for habitation. Although they are vulnerable members of the society, we want to make sure that they also have access to these vaccines. This type of collaboration is what we look forward to with other MDAs. We therefore urge all MDAs to work with us in facilitating the rapid vaccination of their personnel. This has become even more expedient in view of the emergence of the Omicron variant, which is more virulent than other COVID-19 strains that we have seen. Every COVID-19 infection gives the coronavirus a chance to mutate. You've heard this from the DG of NCDC and the chairman of the PLC. Therefore, being vaccinated helps prevent the emergence of these variants. At this point, we would also like to address the myth that if one has had COVID-19 disease and has recovered from it, then they are protected and do not need to get vaccinated. This is patently false. Studies have shown that if you have had COVID-19 before and you are not vaccinated, your risk of getting infected is more than 2 times higher than those who were infected and got vaccinated thereafter. We are aware that people hesitate to get vaccinated against COVID-19 for many reasons, ranging from personal views and fears to logistical problems of getting to vaccination sites. But waiting too long to be vaccinated allows the virus to continue spreading in the community with the emergence of new variants. Severe COVID-19 can be very dangerous, so the sooner you get vaccinated, the sooner you are protected. This is a period of intensive drive to protect Nigerians against the new variant and indeed avoid the 4th wave of this pandemic. We are not taking anything for granted. We are not compromising on safety and standards, and we are fully monitoring all adverse events following immunizations. But as I have always appealed, we need the support of all Nigerians. We need every vaccinated Nigerian to appeal to their family members, their loved ones, their neighbors, and members of their communities to get vaccinated so that we are all protected. It is indeed a collective responsibility. So this is a clarion call to all those who have not been vaccinated to hurry up and take advantage of our mass vaccination campaign to receive the COVID-19 vaccine. Those who have received their first dose should also endeavor to go and get their second doses on their due dates for full protection. May I once again remind us that our mass vaccination sites are available in public health facilities, designated health facilities, shopping malls, open markets, schools, general hospitals, tertiary health institutions, recreation parks, religious centers, motor parks, and many other public places across Nigeria. Please engage with your health institutions to understand and identify where these mass vaccination sites are located in your states. Anyone who is 18 years and above is eligible to receive the COVID-19 vaccines free of charge at any of the designated vaccination sites. Please visit www.nphcda.gov.ng for the list of these vaccination sites. I'll repeat, www.nphcda.gov.ng. Distinguished ladies and gentlemen, we have also been monitoring how states have been intensifying the ramp-up of the COVID-19 vaccination. We have ranked them according to their performance. As of today, the top 5 states that are doing a massive job of offering the vaccines to their citizens are: first position, Ogun State; second, Nasarawa State; third, Oyo State; fourth is Osun State, while the fifth is Ekiti State. We really need to commend the governors for the leadership that they are showing in driving vaccination in their states. And we hope that other governors will show leadership in ensuring that they continue to provide this vaccination site and create demand for vaccination. I know that there are a number of governors who have not been listed here but are doing a lot of work, but they do need to do that work in a way that ensures that people actually go and get vaccinated. We will continue to provide you with daily updates of how the governors are leading the effort to ensure that their citizens are fully protected with COVID-19 vaccination. We'll be sharing this on our websites and our social media handles. Distinguished ladies and gentlemen of the press, let me once again appreciate you for your continued professional support in informing and educating Nigerians on the benefits of COVID-19 vaccine. And I want to reiterate my call for the intensification of actions in mobilizing eligible Nigerians for improved vaccine uptake. We will continue to count on your professional backup to intensify awareness and educate Nigerians on the mass COVID-19 vaccination in the country. Finally, I want to remind us that no one is safe from COVID-19 until everyone is safe. For those who are yet to take the jab, I want to point out that we now have over 6 million Nigerians who have taken the vaccine. Over 6 million Nigerians cannot be wrong. What are you waiting for? Please go get your jab. I thank you for listening. God bless you.
Mr. Chairman and Secretary to the Government of the Federation, Honorable Ministers, members of the PSC, ladies and gentlemen of the press. There is no doubt that currently there is a global concern about the new COVID-19 variant, the Omicron, which was discovered in Botswana and announced by South Africa last week. There are palpable fears that this variant could be on its way to Nigeria, in view of the number of countries that have currently reported detection of this variant. As of today, there has not been any detected case, and the PSC has continued to review our risk of this latest information and take every necessary step to stop it from being imported into the country. We have taken far-reaching proactive measures to minimize and mitigate this possibility. Consequently, the PSC will be issuing a travel guideline document tomorrow. But let me highlight the content of this travel guideline. Passengers arriving into the country are required to do a PCR test 48 hours before departing. They will also do day 2 and day 7 PCR test on arrival, and they will be required to self-isolate for 7 days. Passengers that are outbound, going out of Nigeria, will be required to either show proof of COVID-19 vaccination or provide a negative PCR test taken 48 hours before departure. These conditions apply to diplomats as well. The measures will come into effect by Friday, 3rd of December 2021. The PSC will ensure that there is enforcement of passengers who arrive and refuse to take test through suspension of their passports and prosecution, or both. Furthermore, we will be increasing our surveillance at the points of entry into the country, intensify testing and contact tracing, and optimize sequencing capacity. One of the reasons driving COVID-19 and the emergence of variants of concern, such as this new variant Omicron, is the promotion of vaccine nationalism, which refers to the pervasive inequality at global level that makes rich countries to be able to procure vaccines for their own citizens through direct agreement with pharmaceutical companies, while low and middle countries are lagging behind. They are unable to act as speedily as the rich countries and also not able to secure the quantities of the vaccines that they need. A slower and delayed vaccination rollout in low and middle-income countries has left many of the citizens vulnerable to COVID-19 variants. It leads to new surges of infection and also slower rates of recovery. Whereas most of the developed countries have already vaccinated over 60% and above of their population, most developing countries are below 5%. You've just heard from NPHCDA that we've just vaccinated only 6 million with only one jab. Lack of vaccination in our countries will breed fertile ground for the virus to develop mutations, which will in turn threaten progress already recorded. It is therefore important that the developed countries support the efforts that is being made globally to ensure that there is equity and access for vaccines. What we have in Nigeria for now is the inability of our people to come out en masse and take these vaccines. The methods that have been outlined earlier on should be pursued by the state government, by community leaders, religious leaders, traditional leaders, to ensure that we get everyone vaccinated. The chairman had already mentioned our drive towards the COVID-19 summit, which comes up from 6th to 7th of December. We're just 1 week away from the commencement of this summit, which will help us to redefine our national COVID-19 response and build the health security framework for the country. We are mobilizing all critical stakeholders, including our development partners, for this important national summit. We are heartened and encouraged by the support we have received so far from our development partners and the private sector. I wish to encourage Nigerians and the international community to visit the website of this summit. There will be a virtual session that can be accessed by all. In order to register, you will log on to the website http://2021.covid19summit.com.ng. I want to thank all Nigerians, members of the diplomatic corps, for their understanding in our procedures, our international development partners for providing technical and financial support, members of the press for doing your work to ensure that we advance the cause of public health and Nigeria remains a very safe environment. Thank you very much.
We sincerely thank all the presenters with those reports. The time has now arrived for my colleagues in the media to now raise some questions. So who takes question one? Nigerian, NTA.
Good evening, Chairman and members of the PSC. My name is Mitare Ikben. I report for the NTA. Canada yesterday said it detected its first cases of the Omicron strain in 2 persons who traveled recently to Nigeria. And it leaves a lot of persons wondering why our authorities couldn't detect these cases either at the point of entry or departure from the country. And I want the DG of the NCDC to speak to this. And this challenge also speaks to the problem of people purchasing test results and vaccination certificates, which the PSC has alluded to. And if this continues indefinitely, it will definitely be difficult to detect cases, and we'll find cases being detected in other countries, like we've seen now in Canada. So what is the PSC doing to bust the vaccination and testing racketeering that is going on at the moment? I think the technical head of the PSC will want to speak to that. Some travelers are having difficulties uploading their QR code for test results on the web for officials to check. And also many persons coming into Nigeria from other countries are having this challenge. And it brings a lot of fear of forfeiting expenses made for ticketing and even for test results and all of that. So I want to ask the DG of the NCDC what is being done to make sure that the portal functions very well and that people don't have these difficulties. What are you doing to eliminate these bottlenecks? Thank you.
Good evening, all. Rachel Abuja from the News Agency of Nigeria. My first question is for the chairman of the Presidential Steering Committee. Sir, you keep saying you won't like to speak about the fraudulent act that is going on because it's kind of big. But some Nigerians are saying that. You keep saying that you don't want to speak, you don't want to say anything about the fraudulent act going on the vaccine, people getting vaccine card, people getting fake test results. That is so much. We hope the committee will be naming and shaming so that Nigerians will believe that this act are actually ongoing, because they keep saying there's nothing like that, there's nothing like that. That's for you, sir. And for the Honorable Minister, sir. Sir, you, I think 6 or 8 weeks ago, you said you'll be considering testing on arrivals for people coming into Nigeria. I would like to know how far we've gone about that. For the ES, sir, well done. In the last 1 week, we've been together, and some of us, we actually gone into the communities to find out if this vaccination process is actually ongoing. And you found out that some Nigerians, I don't know if you are aware, don't know what the COVID-19 vaccine is actually talking about. They can remember polio. So I would like to know what you're doing to scale up education of this, educating communities on the awareness of this. Again, still with you, sir. A lot of Nigerians said they've actually taken their jabs, but their names are yet to be uploaded in your portal. What are you doing about this? And you made mention of asking the civil servants, or you check them if their card is fake or legit. How do you hope to do that when these people have the same QR code numbers? For the NCDC DG, sir, Nigeria is so big a country, and we just have 4 sites for genome sequencing, which is shocking. So when we say we don't have these variants in the country, some experts are smiling. Our borders are porous. We have over hundreds of thousands port of entries. We would like to know how you hope to scale up our genome sequencing, and who fund this, the sequencing site? And I would like to also know who the people that fund it. Is it the federal government that is funding this site, or development partners? And as of today, how many of these sites are operating? How many of them are working? Because you did not say anything on that. Again, sir, we spoke about the test last week. Sorry, the last time we had briefing, I made mention of how come people leave Nigeria and go abroad and test positive? And I asked, how do you interact with the lab and the private lab? You didn't answer, so I hope you answer today. Thank you.
Good evening. My name is Gloria Omezeke from Channels Television. My question is to the National Primary Healthcare Development Boss. About Indonesia. We heard about Indonesia banning flights from Nigeria into their country. Are we planning similar restrictions from other countries, particularly South Africa? And then we're expecting the president of South Africa. Is that measures going to be intensified to test, for instance? Thank you.
That appears to be the outlook of all the questions that we have this evening. At this point in time, I would respectfully invite the Honorable Minister of Health to kickstart the response to these questions. Honorable Minister, please.
Thank you. The question from, I think, Rachel is about testing on arrival. Testing on arrival is a practice that's used in many countries, but here in Nigeria, due to logistic reasons and reasons of managing situation, we have looked at it, but we have not found a way around those logistics yet. Perhaps if we do, we can go back to it. But right now, we are working without directly offering testing on arrival. The other question was about flights to South Africa, if I heard you correctly, or from South Africa. Did I hear you correctly? Indonesia. Flights to Indonesia. Well, we don't have direct flights to Indonesia or to several countries. They're all indirect. You have to have stopover in one place or the other. But I think I will leave Dr. Mukhtar to respond to that. That is the area that he is concerned with.
Well, thank you very much for your questions. I think there's a question about the travel portal. And as you might recall, at the last press briefing, there was an update on the switch to the new portal, the new platform, and how that's functioning. And it is, we believe that the portal is functioning well. And interestingly, yesterday I had asked for a performance review, and the portal has had only a 1.3% downtime in the past week. So it means that most of the time it is up and running. And when people complain about something wrong with the portal, it also people do not say specifically what the problem is. And I think the assumption is because everybody is coming from abroad, instantly their internet must be better, but it's actually not true. Depends on where you are. But we are continuing to look at the situation. As we say, people should please, the helpline works. We collate the responses. They help us identify problems that are used to tweak the portal. If you try something now, just like for many other things, and if it doesn't work, please try again. It might be traffic, it might be other issues that are occurring at that time. But the portal has had very, very little downtime since the initial teething problems were sorted out. In terms of, I think there's a question that I didn't answer last week. We review the performance of all the testing labs in the network. There's actually a colleague of mine who sends me KPIs every week. Okay, about what the labs are doing, what samples they have booked, or what samples they have done, and the like. So we do monitor what is going on in those laboratories. There's a question about genome sequencing. Yes, we do not have the capacity for genome sequencing as the South Africans do. But I think what I need to remind you of is that before COVID, we were at basically zero. And now, with a few of the labs in the genomic surveillance network, we have almost 10 labs that are sequencing and depositing sequences in the public database. So our challenge at the moment is not actually about how to sequence, because there is excess capacity in the network. Our problem is if you do not test and do not identify enough positive samples meeting the criteria for selection for sequencing, then you have no samples to sequence. So that is the issue. There's a question about which labs are able to sequence. Well, the National Reference Lab at the NCDC can sequence, has sequencing capacity. The SGIT group led by Professor Christian Happy at the Redeemers University obviously have had a head start on sequencing or genomics in the continent, and are a center of excellence for genomics of infectious disease. So they still sequence, and if you check the public database, they have contributed most of the genomes that we have to the database, followed by us. NIMA sequences. In terms of the private facilities, 54 gene sequences. The lab in Ibadan sequences. The lab in Maduguri, University of Maduguri sequences. And there are a few other labs that have nascent capacity, but I haven't actually quite seen samples to test. And we plan, before the advent of this variant, we were actually planning another meeting of both existing members of this genomics network that was set up by my predecessor and others that are willing to join, just in a bid to ensure that we actually document and record all of the capacities that are available and reinforce referral arrangements and indeed governance arrangements for sampling. In terms of funding, yes, the NCDC, NRL, there's substantial funding obviously from the federal government, and a lot of funding in the past year before I arrived, even from the COVID-19 intervention funds. But we also we've had tremendous support from partners, even WHO in the advent of this new variant has even offered additional help. And we have other partners that are providing some form of one support or the other. My interest is to know also that we expect a significant scale-up in genomics capacity once the Global Fund C19RM grant comes into implementation. So things in terms of genomics capacity can only get better. But I think I need to reinforce that it's more than just having a lab and having equipment. Citizens must test. Citizens must comply with travel advisory in terms of tests and so on and so forth to actually have samples to sequence. There's a question about South African delegation, I think. Well, as is usual with a lot of these visits, lots of partners involved. So the Ministry of Health is working closely with the Ministry of Foreign Affairs, and as the arrowhead of the Ministry of Health, we have actually been conducting testing and screening, and will continue to do so as more of the South African delegation arrives. I think the final question I haven't answered is about tests, positive tests being detected elsewhere. This is not a one-way phenomenon, okay? When we look at the data for people that are arriving from other countries to Nigeria, for example, because a lot of our returnees are also from the UK, the UK returnees have the highest number of positive tests that are detected here on arrival after departure from the UK with a negative test. So we have people testing positive from the US, we have people testing positive from a whole lot of destinations. So the reason is every test has its performance characteristics, even the best tests. And every test has a period in the when you contract an infection during which they can return a positive result. So if you test anybody too early in the course of their infection, then you may get a negative result. And it might be that 2 days, 3 days later, when the person has arrived and there's been sufficient replication or multiplication of this virus, then you detect it. So this is a well-established phenomenon across the world. It's not a failure of Nigerian labs testing or Nigerian labs not picking up, in this case, the variants in the passengers that travel to Canada. Again, as I said, we are waiting on the Canadian authorities to give us the full details of these particular travelers. There are no direct flights between Nigeria and Canada. We do not know which other countries these passengers transited in. It is likely, of course, that when they left here, assuming that their journey originated from here, they would have had a negative PCR test. Thank you. Okay. I think I've covered my questions.
Okay, thank you. The first question was from Rachel. She asked why, that you were in some communities within the FCT and some people did not know about COVID-19 vaccines. I think this is exactly what we've been talking about, that this is a collective effort, right? It is not an MPH-CDAO effort. It's not the Federal Ministry of Health alone. It's not the PSC. It's everybody's effort, including yours, right? We have to continue to try and educate all Nigerians about not only COVID-19 as a disease, but also the fact that we have these vaccines that are available. This is why we're engaging with traditional leaders, with religious leaders, so that we can use these channels to communicate. So your point is noted, but as much as we can, we continue to collaborate with the Federal Ministry of Information, National Orientation Agency, and we're using their platforms and their personnel to make sure that we reach people in the communities. And we welcome all the help that we're getting from the media to make sure that this information permeates our communities, we saturate our communities with the correct information about COVID-19 vaccination. Then you asked about some people who do not see their names when they scan their QR codes. I think for the last month or so, we've provided a link to all Nigerians, and we've had public service announcement asking people to go on the NPHCDA website, and they can actually scan their QR codes and make adjustments to their data. If there's any reason why they are not able to do this, there's a helpline where they can actually call, and they'll be guided as to what they can do. We know that this is something that will help people not only fix some minor problems, but the help is out there for people who are having these kinds of challenges. Then you asked, how, we can distinguish between the fake COVID-19 vaccination card and the original one. Surely, I'm not going to tell you, right? That is something that I cannot share, because then you will now allow the fraudsters to try and perfect their act. Okay? Well, thank you very much for bringing it up.
We've listened well enough to the responses that have been given. Let's now invite the chairman of PSC for your closing remarks. You're welcome, sir.
No, I think there was a question directed at me. Yes, sir. Mitare, what were you trying to, who was it that asked? I thought it was you. South Africa. Whether we were going to impose flight restrictions. Was it Gloria? Okay. Well, I think with regards to that, why particularly South Africa? The variant is invariably on all continents now. So why particularly South Africa? We would keep reviewing the situation, and at the appropriate moment, like we did at the outset of the pandemic, we shut down to everybody. Because right now, the Omicron variant is all over. Those that have done their genomic sequencing have established that we are also trying to establish. So far, none has been dictated and established in our country. Only people who have a history of having traveled to Nigeria. What happens in between their travel time to Nigeria and other places they have gone to? They could have picked it up there. Like I said, in my opening remarks, quoting the DG of WHO this afternoon, he said the emergence of the highly mutated Omicron variant underlines just how perilous and precarious our situation is. And South Africa and Botswana should be thanked for detecting and sequencing and reporting the variant. And the truth about it is that as long as the globe or the world continues to discriminate in vaccine supply and administration in an equitable manner, the so-called big guys will keep locking down and paying for the consequences of their action or inaction, which would always be costly. At the outset of this pandemic, there was one catchy phrase that has remained a constant dismal. No one is safe until all of us are safe. And that is what is playing out. That's the playbook. You can lock down as much as you can. You can hoard the vaccines as much as you want to hoard them. But this virus will get you. Because those people that are inequitably disadvantaged in the supply of the vaccines would have the virus keep mutating in their communities. And the world would not shut down. It would become a global village. People would have to travel. And whether you like it or not, they will take this virus to your doorsteps. And you begin to react in the manner in which we have seen the reactions coming out. But truly, South Africa and Botswana, most of the African countries that first dictated this should be commended. Because if you do not commend them and you begin to penalize them, next time another variant emerges, they keep it under the table. because they do not want to attract punishment instead of commendation. So globally, this is a peril that is afflicting the entire world. And we must collectively begin to respond to it in such a manner. And there must be equity in this. We must share the science. We must share the innovation in the creation of the vaccines so that as quickly as possible, the disadvantaged nations can begin to have access to this vaccine, either in terms of upgrading their facilities for the production of the vaccines. A part of the thing that is informing vaccine hesitancy, even in countries that have a long tradition of manufacture of vaccines, like the United States, you find out that among ethnic groups, there's some element of hesitancy. It's because of the way vaccines have been applied in the past. Even in this country, we've had our own share when polio vaccine first came in. You remember clearly what happened in Kano. So those issues can only be addressed if you give us the benefit of the intellectual property that you have over the vaccines so that we can locally produce this vaccine. And that would inspire confidence in our people, that this is a local thing that has been produced, that is fit for use for our people, and is good for our people. The world must come to the conscious understanding and realization that this pandemic will not go away if we continue in the manner in which we are administering these vaccines. And as a country, I would want to say that we've not done badly in our national response to COVID-19. And we will continue along that path, to be cautious, to be guided by the science and the facts and the data available. And we look at global practices all over the place. I saw a publication coming out of Scotland, which says that some of the people that have been infected with the new variant of Omicron do not have a travel history. They do not have a travel record of a travel history. They didn't go anywhere. They are in their locality. How did they get it? So before South Africa and Botswana did their genome sequencing and establish this variant, it had already traveled on its own to the world. So let the world arise from its slumber and know that we are in for a long haul. And the only way we can conquer this virus and defeat it is if there will be equity and fairness in the distribution and acquisition of the knowledge that deals with this vaccine and even the distribution of what is available now. If you produce 8 billion vaccines and almost 2/3 of the world have not been able to vaccinate 10% of the population, how do you get to herd immunity? How do you get to herd immunity? And unless we get to a certain proportion of our eligible population vaccinated, we will continue to have these mutations and new variants will continue to come up. My encouragement to our fellow countrymen and women is that let's stick to the non-pharmaceutical interventions. That is the surest bet now against getting infected with COVID-19. It's the surest, I can tell you. Probably surer than even vaccines. The non-pharmaceutical interventions, the wearing of masks, the avoiding of mass gatherings, keeping social distancing, living in a very clean and ventilated environment, washing of hands or the use of sanitizers, and as much as possible, reduction in our unnecessary and frequent trips, which will soon come up as the Yuletide season comes. Everybody will be jumping to the motor park or to the airports trying to travel. Some of the trips are not necessary. As a matter of fact, the people in the village will be waiting for you. Send the money. They will prefer to have the money than to have you come with what they call urbanized diseases. Because as far as our people are concerned in the rural areas, if you go, COVID is an elitist and urbanized affliction that we are bringing to the villages for them. And when you wear a mask, I just came back from Adamawa. I was at 2 different events. You could count the number of people that were wearing masks. For a lot of people, COVID is over. But truly, it's not over. Probably we are getting into the most severest part of COVID if we are not careful. Because with the mutation, very soon probably the vaccines that have been produced will become totally inconsequential in dealing with the new variants that have mutated. So we have to be very, very careful. We are not out of the woods yet, so let's prepare for this long haul. I urge all Nigerians to continue to observe the non-pharmaceutical interventions that we have put in place. That is the surest way of dealing with this, until probably we have a permanent cure to it. Thank you, and have a good evening.
Thank you so much, the chairman of the Presidential Steering Committee. Nigeria have been waiting to have this national briefing today. Inquiries have been made, and we are glad that Nigerians have received adequate information on the Omicron variant. The Honorable Minister of Health has told Nigerians to be watchful and to adopt a waiting posture on the Omicron. A lot we do not know. We will soon know so much about this variant. Let's continue to adopt all the necessary non-protocol, pharmaceutical protocol. As we do this, we'll keep the new variant at bay. When next we are going to meet, we'll report to you. Have a good night.